Excellent. Well, thank you for joining me for a discussion about maternal and child health, and in particular, the Black maternal health crisis. Dr. Sharla Smith, the director of the Birth Equity Network, also an associate professor and an expert on maternal health. Dr. Smith, last week was Black Maternal Health Week. We at the Health Fund are committed to investing in making sure mothers and babies have the healthiest start in life. We know that by focusing on these earliest years of life, we can really address long-term health needs and also see great success. However, significant inequities and disparities exist among Black mothers. Can you talk a little bit more about the Black maternal health crisis?
Yeah, so the Black maternal health crisis today is just that Black women are 2 to 3 times more likely to die of childbirth related issues than white women. And what we're seeing, though, in that crisis is we're seeing that crisis happen in the absence of these social determinants of health. So Black women from the wealthiest communities still have worse outcomes. Black educated women still have worse outcomes than all other women. And then Black women who initiate prenatal care in the first trimester still have worse birth outcomes than white women who never seeked prenatal care or who had late prenatal care. And so we're seeing this happen even with all of the mechanisms in place to protect Black women, even though they do not have the impact of social determinants of health, they're still threatened in this childbirth. And so it becomes a crisis because it's like, what can we do to address this? How do we get this information out there and how do we create awareness? And so with Black women, we want to be careful to talk about the things that are impacting them every day, which is maternal stress. So the stress that is impacting their bodies, what's happening in their communities, what's happening on their jobs, having access to quality healthcare and professionals that represent them when they're seeking healthcare, being able to have that representation within the healthcare system and representation within the education systems as well when they are seeking higher education and things that would reduce this impact. And so the idea behind this is to make sure that Black women have everything that they need to have a healthy pregnancy. But we can't continue to have this conversation in the absence of fathers. So when we talk about maternal and child health, we know that fathers play a major role in this, our partners. And so we have to remember that this is a family structure. And what we're really striving for is healthy families. Then therefore, we can really reduce this crisis in our community by all of us working together to create Black healthy families in our community.
Thank you for that important grounding on this crisis. We know that there's no one solution, and you eloquently highlighted that we need to work on reducing stress during and after pregnancy, making sure there's more culturally competent care, making sure there's family supports, and we're really focused on improving not just the health of mothers and babies, but of families, making sure there's community supports, and making sure that there's providers that understand the challenges that Black mothers are going through during and after pregnancy. One policy change that we're excited about that can help tackle some of the access to coverage issues, though not tackle all of them, is the recent decision by the Kansas governor to include a postpartum coverage extension in her budget and the legislature to support that. We hope to see that finalized this week and to be able to celebrate that. Can you talk a little bit about the impact of the postpartum coverage extension on helping address some of the coverage questions as part of improving access to care?
Yeah, I first want to acknowledge that this is a major win for the state. This is a major win in addressing these disparities, and will have a major impact on reducing these disparities within time, right? And so this is major. This is a major win for the state of Kansas. So I want to make sure that I highlight that. But also the fact that in the state of Kansas, most women lose their postpartum coverage between that 6 and 8 week period, right? And so therefore, we don't know about what's happening to their health after pregnancy for up to 1 year. Although we know maternal deaths happen up to 1 year postpartum, right? But we don't know what's happening to their health, and they're not getting they don't have access to healthcare. They don't have access to the necessary services to really address these disparities. But now they will have access to services to really examine them and to determine if they're suffering from postpartum depression. We know that postpartum mental health is is an issue around these disparities, and that is something that has to be addressed. But we also know there's postpartum hemorrhaging, there's postpartum preeclampsia. There are other things that Black women are more likely impacted by in the postpartum period than any other women. And so the reality of them being able to access healthcare for up to a year after pregnancy is a major win for the state and is going to be a major contributor to reducing these disparities.
Well, it's a helpful, positive step, and the leadership of groups like the Birth Equity Network played an important role in helping policymakers and the governor's office understand how important extending postpartum coverage is, helping them understand that 9,000 women will have coverage for 10 more months, critical years, as she said, to making sure we could prevent deaths, to help make sure coverage is no, paying for coverage is not as much of an issue, and really making sure those services are available. But we know that there's other challenges that exist. Can you talk a little bit about the Birth Equity Network and some of the other priorities that you have?
Yeah, so the Birth Equity Network is really the idea to bring together the stakeholders in Kansas to create solutions for Black maternal, paternal, and infant health. And really the realities around that is not just that these women need to seek health care, but they also need to seek resources in the community, also need support. They also need to know the power that they have, right, in this birthing experience. So the reality of KBN is really to give that to them, is to provide all resources needed, to work collaboratively with stakeholders to create solutions, whether that's extending postpartum care or access to postpartum care, but also when we're doing that, to make sure that it's patient-centered. So we have a parent group, and we really listen to those parents and what they need in the community and how we could better address their needs within the community. So KBN really stands to be that patient-centered focus network that brings together these diverse stakeholders, which means in the areas they work in, not in race, but all of those stakeholders that are working on maternal and child health, to really create these solutions, but also to create a resource hub so that parents can come to one place and find whatever resources are needed. We know that our state offers a number of resources, but they're not accessible. So making that more accessible to them, also having community forums to increase awareness and knowledge around these maternal and child health issues and how we can work together to support birthing persons in this experience. And then more importantly, is disseminating that information in a parent-led experience. So having parents really help us to disseminate that out into the community, to make sure that everybody knows about this crisis and what we can do as a community to address these disparities. And another factor of KBN is that we work here at the University of Kansas to really increase the awareness and knowledge of our residents. So we have a birth equity scholars training fellowship as a 2-year fellowship for OBGYN and family medicine residents to increase their awareness of birth equity, to give them the experience and exposure with working with organizations in our community that are doing this work, to give them experience in policy making in our state and some experience with going to the state capitol and how to advocate for certain policies that impact maternal and child health, and to work with them to produce scholarly documents in this area. So we're not just looking at community engagement, we're also working to change that output that our providers have and to increase their awareness and knowledge of birth equity. And then we're also working to create a scholarship so that we can have a medical students come to KU that is interested in obstetrics and gynecology and give them early exposure to birth equity, because I think one thing that KBN believes is that it's going to take all of us. So not just the parents, not just the community stakeholders, not just the policymakers, but also the providers. So we have to create that awareness and education on each level so that we can create birth equity in our state.
I'm really glad you highlighted the role of both community members understanding and parents understanding the challenges faced by Black mothers during birth, how to work towards a more equitable experience for them, but really underlying the importance of the providers in this experience, because oftentimes providers are not aware of the challenges that exist and how the systems and structures really discriminate against women of color and result in a more negative experience and ultimately worse birth outcomes and worse outcomes of health of both the mother and child in the first year. So the training of providers is really important. Can you talk a little bit more on the provider front about the importance of having providers that understand these experiences, that are trained to address disparities that exist, both in experience and outcomes. And then just the importance of having a culturally competent care team from doctors down through nurses and possibly community health workers as part of this experience, so the women get the supports they need and we see the outcomes that we want to achieve.
Yeah. So, KBN creates this space where we have patients, we have community stakeholders, we have doulas, we have a midwife, we have providers in one virtual space discussing solutions. So not only do the providers get to understand those systemic factors that create barriers for women of color, for Black women to seek care and have access to quality health care, but patients get to have that shared space with providers so they can understand the provider's perspective when they're giving care. And so it's very important that they have that clear understanding to improve that decision-making factor, to improve that trust. So to make sure that there's that patient trust the provider and provider trust that the patient has that understanding. But I think this BEST program, what it does that I love so much is that it allows these providers early in their education, right? So they're providing care to these communities and all they hear is the data. All they hear about is how likely Black women are to die and what is happening as it relates to data. But they don't understand their culture. They don't understand the issues that they're dealing with outside of the healthcare system. And they may have had limited experience with working with diverse populations. And so this allows them training and exposure to those communities and those community organizations like Uzazi Village or Wichita Birth Justice Society that are working in those communities to provide healthcare. And so now when they provide care, it's culturally sensitive, it's culturally centered, it's patient-centered, and they understand that there are more factors than the healthcare system in providing care to Black women. And so it gives them exposure to Black women over a period of time. It gives them the understanding of them. And most importantly, it will allow them to trust that Black women do know their bodies, right? And even if they're wrong, that they need to take a step back and examine them to make sure that there is not an issue, right? And so that will give them that exposure when they're providing care. And so it's a really great opportunity to do that. But not only that, for them to actually get exposure to policymaking. Because as a resident, you don't truly belong to an organization, but you are an MD. And so you can have a major impact on the policies that are made in your state that are impacting maternal and child health. So they'll have the opportunity to influence policies that hopefully will address these disparities in Black maternal and infant health.
Thank you for sharing that. I think it's really critical for us to continue to think about how we can center Black women in the maternal process, from prenatal to the delivery process to the first year of life and beyond, so that we're creating not just healthy mothers, healthy children, healthy families. Any last thoughts on how folks that might be listening could join you in helping center Black women in this experience?
Yeah, so if you really want to join us in centering Black women, join the Kansas Birth Equity Network. We have a website on the KU website, so just look us up, KUMC Birth Equity Network, or send an email to smith37@kumc.edu, or join one of our organizations that are doing this work, right? Get involved in this work, get educated, support your community members, support your neighbors and your friends that are Black women and they're adventuring in these birth experiences, and just stand with us and understand that Black women, when Black women are thriving, then we're all thriving. When women are healthy, then we have a healthy community. And this means that not only are they contributors to our society, but they're thriving really well in our communities. Our economics are doing well and things are going well in our state. And also to support the governor as she's making these very vital decisions to make sure that every woman gets the care that they need, whether it's in the prenatal period or the postpartum period. And so we have to step up and do our part. And that means not only supporting Black women, but supporting our governor as she's making these vital decisions to make changes in our state.
Thank you, Dr. Smith. Again, it was great to have this conversation today to just talk a little bit more about what we all can do to better support Black maternal health, and also to celebrate the governor, the legislature, for their leadership and making the bold policy decision to extend postpartum coverage to from 60 days postpartum to 1 year postpartum will benefit 9,000 women, and really is a critically important first step to helping improve access to services and improve health outcomes for Black mothers and children. So any last words?
Yeah, I think we should, if you haven't thanked your legislator and your governor for making this decision, maybe the time is now to write a statement, thanking, an email, or make a phone call thanking them for making this decision, for becoming a part of the solution, but also to examine yourself to say, how can I become a part of the solution in making sure that Black women and infants are thriving in this state? How can I become a part of that, and what can I do? And so in asking that yourself that question, whatever that answer is, get involved now and don't wait. And also to support providers that are Black, because they're also dealing with the idea that they may harm a Black woman. And so I think one thing that we forget is we forget about our providers and the things that are impacting them. And so to support them and to know that they're doing their best to provide quality health care. All providers took an oath to provide quality health care, so they really want to do that. And then I think all patients want to be healthy and have a healthy birth. And so we have to support both when we're supporting Black maternal health.
Absolutely. I think that's a great way to end. And I think we all have a role in improving Black maternal health and improving maternal health in Kansas. We just took a big step forward, and we're so fortunate to have your leadership in the Birth Equity Network here in Kansas. So thank you so much for this conversation and all of your leadership, Dr. Smith.
Thank you. I'm grateful for the opportunity. It's a great time to be a Kansan.